Welcome to Unit 1, Section 4, Assessment Techniques. In this lecture, we are going to discuss special tests before you work your way through the demonstration videos. Each test is on a separate video, so it's easy for you to go back to them. Special tests are chosen via the information gathered from the subjective history and the range of movement tests already carried out. Special tests are designed to stress specific structures in a specific way to help you rule certain things out or in. You are trying to recreate the symptoms your client has complained of. There are dozens of special tests. We go through a good number, but there are far more out there. So have a look around and see what you can find. Some you will find really useful and others far less so. You will also see different practitioners carry them out slightly differently, but the underlying principle stays the same. These tests could be testing any structure, so any active or passive structure. It depends what the test is. It's not like your passive range of movements and your resisted range of movements, so it could be a mix of structures. Key points to remember when carrying out special tests. As always, remember to communicate well with your client, explaining what you're going to do. Some of these special tests are active and require your client's input, so explain or demonstrate carefully and clearly what you would like them to do, and also explain if it hurts they can stop. Get the client in the most comfortable position to do the test that you can. You don't have to do dozens of tests, and probably more importantly, just because a test comes in positively or negatively, it doesn't mean that it's right. These tests are not as accurate as people like to think. Each test is designed to cover a specific issue, so ensure you're choosing the right test for the right job. Some, like Thomas tests, will give you lots of information about various structures. Others are very limited and very specific. On the course, you will need to do 2 per consultation, but in clinic you'll do what is appropriate, but never over-test. I recommend you don't watch too many videos at once, only watch a couple and then go and practice them, and then you can come back and move on to some more tests, but don't overload your brain with them because you'll get them muddled up. You can now complete the quiz associated with this lecture and move on to the tests.